In today's video, we'll go through the evidence-based benefits of ashwagandha and the things you must know before you take it. Let's get into it. Ashwagandha, also known as Withania somnifera, is a herb used in ancient Indian Ayurvedic medicine which can be traced back to 6000 BC. In Sanskrit, the name Ashwa means horse and Gandha means smell, since the fresh fruit smells like a horse, but the herb is also thought to give you the strength of a horse. Ashwagandha has many benefits. We'll go through each condition briefly and then we'll go through the finer details of how you should and shouldn't take it. First up is stress and anxiety. Ashwagandha is known as an adaptogen, which is a herbal product that helps your body adapt to stress. A recent 2022 meta-analysis consisting of 12 studies concluded that ashwagandha significantly reduced stress and anxiety compared to the placebo. Ashwagandha helps by regulating and reducing the amount of cortisol and DHEA in our body. Number 2, athletic performance. A recent 2021 analysis concluded that ashwagandha improved strength and power, cardiorespiratory fitness, and muscle fatigue and recovery in healthy males and females. It is believed to be due to its antioxidant properties. Number 3, sexual performance and testosterone. Now, before Viagra even existed, ashwagandha was used traditionally to improve sexual performance and desire in men and women. In a study including 50 females, they found there to be an increase in orgasm, satisfaction, lubrication, and arousal, but not sexual desire. The reasons why ashwagandha can improve sexual performance can be attributed to 3 main reasons. Firstly, ashwagandha plays a role in regulating stress. High stress levels are known to reduce your libido, arousal, and orgasm. Secondly, ashwagandha has shown to increase testosterone levels by up to 14%. Thirdly, ashwagandha is found to stimulate nitric oxide production, which may help to dilate the blood vessels in the genital area. Now, there is no evidence to support the use of ashwagandha in erectile dysfunction in men, but can help to improve libido, physical performance, and sexual satisfaction. Next up is type 2 diabetes. A review of 24 studies concluded that in people with diabetes, ashwagandha significantly reduced blood sugar, HbA1c, insulin lipid profile, and oxidative stress markers. There has even been suggestion that the effect is comparable to oral diabetic medication. Chronic stress, both emotional and physical, has been known to lead to insulin resistance. Next up is sleep. Ashwagandha has been shown to improve sleep quality, help you to fall asleep quicker, and reduce awakenings, particularly if you suffer from insomnia. It's not well known how ashwagandha improves sleep, but early research has found that it acts on the GABA receptors, which plays an important role in regulating sleep. Many prescription medications for sleep and anxiety also act on the GABA receptors. Keep in mind it may not work straight away and can take up to 10 weeks before you notice any improvement in sleep. Next up is blood pressure. Ashwagandha has been shown to have the potential to lower your blood pressure. Now, the effects on blood pressure is thought to be due to the fact that ashwagandha lowers stress, and increased stress is found to be linked with high blood pressure. Now, there are many other possible benefits, including having possible anti-inflammatory effects, anti-cancer effects, increasing thyroid levels, improving memory and focus, improving immune health, sperm health, and heart health. It's hard to determine an exact dosage since the different studies use various forms such as powder, root extracts, and a combination of root and leaf extracts. There are actually many different bioactive compounds present in ashwagandha, which have different effects on the body. The main bioactive compound, which you may see on the label of a supplement, is withanolides. For example, if you take 1000 mg of ashwagandha, it doesn't mean that you're getting 1000 mg of the active compound. Just like if you eat 100 grams of chicken, you're not actually getting 100 grams of protein. Now, doses typically range from 125 mg to 1000 mg per day, but the doses can go higher. It's not an exact science, so you may need to try it and see what works for you. For most conditions, I would suggest starting on the lower to mid-range doses and working your way up. For anxiety, I would suggest starting from 600 mg a day going up, as clinical studies found that higher doses were more effective. But always follow the instructions on the package. Now, when choosing an ashwagandha product, it's important to look for a reputable company and be careful with buying products online, as unregulated products may contain contaminants such as lead, mercury, and cadmium, and these can lead to toxicity. If you're unsure if the company is reputable, if you're buying online, or if you're buying from a country where herbal products aren't regulated, then look for products that have been third-party tested. You may also notice different types of ashwagandha when you look at the packaging, KSM 66, Sensoril or Shodan. These are all standardized extracts which use specific extraction methods to guarantee a certain percentage of some bioactive compounds. The majority of clinical studies have used one of these three forms of ashwagandha, particularly KSM 66. Ashwagandha can be taken with or without food, dosed as either once or twice a day. Since it usually takes a few weeks before it starts working, you can take it at any time of the day. Although most people who take it for sleep prefer to take it at night. Now, some studies had their participants taking ashwagandha with warm milk. In Ayurveda, milk is seen as a rejuvenator that nourishes the tissues in the body. Since ashwagandha is also a rejuvenator, it is thought that milk is complementary to ashwagandha. If you're lactose intolerant, you can substitute milk with a different type of milk, such as almond milk or rice milk. Now, many studies also had participants taking ashwagandha with water, so you don't have to take it with milk if you prefer not to. Long-term clinical studies have yet to be done. It is established that it is safe to take for up to 3 months. Ashwagandha is very well tolerated, but some possible side effects, especially at high doses, include stomach upset, diarrhea, vomiting, and very rarely liver damage. There are 6 groups of people that need to be careful before taking ashwagandha. 1. If you're pregnant or breastfeeding. There is not enough evidence to say whether it is safe to use in pregnancy or breastfeeding. Ashwagandha was very recently banned in Denmark based on the thought that at high doses it may cause miscarriage. There is no clinical evidence to back this up. I would always advise to err on the side of caution and avoid taking it during pregnancy and breastfeeding. Number 2. Thyroid problems. There was an 8-week randomized controlled trial that showed beneficial effects of ashwagandha on T3 and T4 levels in people with hypothyroidism. The problem is that there have been 2 human cases of thyrotoxicosis, which is when you have too much thyroid hormone in your body and can cause symptoms such as heart palpitations, anxiety, muscle weakness, heat sensitivity, and in severe cases can be life-threatening and cause loss of consciousness. So if you do have any thyroid problems, make sure you speak to your doctor before taking ashwagandha. Number 3. Autoimmune diseases. Ashwagandha has immune-stimulating properties, which theoretically could exacerbate autoimmune diseases. Examples of common autoimmune diseases include Crohn's disease, type 1 diabetes, multiple sclerosis, rheumatoid arthritis, lupus, and psoriasis. Number 4. Prostate cancer. As ashwagandha may increase testosterone levels, it's best not to take it if you have hormone-sensitive prostate cancer. Number 5. Allergy to nightshades. Ashwagandha is part of the nightshade family, which also includes tomatoes, eggplants, potatoes, and capsicum. If you have an allergy to other nightshade plants, there is a chance you could be allergic to ashwagandha. Number 6. Scheduled surgery. Now, if you have any scheduled surgeries, it's important to stop ashwagandha at least 2 weeks before going into surgery, just in case there are any interactions with medications given during the surgery. If you're currently taking any medications, particularly immunosuppressants, sedatives, thyroid medications, diabetic medications, blood pressure medications, or blood thinners, then make sure you speak to your doctor first before taking ashwagandha. I'll include a link below to my other video if you want to look more in depth into why these medications interact. So that comes to the end of our video. If you found anything useful in this video, please consider subscribing. Thanks for watching, and I hope to see you next time. Bye!